Welcome to my channel Medicine Guide. Welcome to my channel Medicine Guide. Welcome to my channel Medicine. Please subscribe to my channel Medicine Guide. Is it safe to take Tylenol with ibuprofen? How to alternate Tylenol and ibuprofen? It is important to clarify that you should not take both Tylenol and ibuprofen at the same time. The idea is to alternate between the two medicines. So, how close together can you take Tylenol and ibuprofen? Take one first, and then 4 to 6 hours later, take the other. You can alternate these OTCs to help with pain control and fever reduction. You have back pain, headache, or a fever. Typically, you would turn to acetaminophen or Tylenol or ibuprofen to help alleviate your pain. But can you take Tylenol with ibuprofen for additional pain relief? Both ibuprofen and Tylenol are pain relievers and fever reducers. They both can reduce inflammation, but they work in slightly different ways and are processed by different parts of the body. It can be safe to take them together if taken as directed. First, we will see how both medications work and how to take them together, how Tylenol and ibuprofen work. Acetaminophen, like Tylenol, is an analgesic, a type of drug that reduces pain signals within your nervous system. It is typically used to treat pain like headaches, joint pain, and toothaches, and to reduce fever. When you take Tylenol, the drug is processed through your liver. You can find Tylenol in tablet, capsule, or liquid form. Ibuprofen, like Advil or Motrin, is an NSAID, non-steroidal anti-inflammatory drug. This type of drug blocks your body's production of prostaglandins that cause inflammation. It is typically used to treat back pain, earaches, menstrual cramps, and toothaches, as well as to reduce fevers. When you take ibuprofen, the drug is processed through your kidneys. You can find ibuprofen in tablet, capsule, liquid, or rectal suppositories form. If you have an injury, back pain, or have a fever, you can alternate using both of them. There are multiple studies that show that we have better pain control with the combination of Tylenol and ibuprofen than with some of our less safe pain medications. As Tylenol and ibuprofen work a little differently, the combination of targeting different pathways is beneficial for pain control and fever reduction. And while both Tylenol and ibuprofen are typically safe, it is said that if you have kidney, digestive, bleeding, or liver problems, you need to be careful with taking these over the counter OTC medications. How much Tylenol and ibuprofen can you take together? It is important to clarify that you should not take both Tylenol and ibuprofen at the same time. The idea is to alternate between the two medicines. So, how close together can you take Tylenol and ibuprofen? Take one first, and then 4 to 6 hours later, take the other. For example, if you wake up around 8 a.m., start off by taking 400 milligrams of ibuprofen, and then around noon, take 500 milligrams of Tylenol. You can alternate like that every 3 to 4 hours throughout the day, instructs by the doctors. You also want to be aware of the recommended maximum dose for each. For adults and children over the age of 12 years, you don't want to go above 4000 milligrams of Tylenol or 1200 milligrams of ibuprofen. There can be some serious risk if you take more than the recommended dosages. If you take too much Tylenol or drink alcohol while taking an Tylenol, you may cause liver damage, and if you take too much ibuprofen, you may cause kidney damage. This routine can also be used for children under 12, but doctors recommend reaching out to your child's pediatrician to get the right dosage for your child and their body weight. There are also some other side effects associated with both Tylenol and ibuprofen. Tylenol side effects include headache, nausea, vomiting, loss of appetite. Ibuprofen side effects include upset stomach, nausea, diarrhea, vomiting, leg swelling, It is recommended taking both medications with a little bit of food like a couple of crackers, yogurt, or a banana to help prevent the stomach upset, said by the doctors. FAQs, frequently asked questions. How often can you take Tylenol with ibuprofen? If you are taking Tylenol with ibuprofen consistently for more than 3 days, doctors advises talking with your healthcare provider. They can be safe to take together for longer than that. But if you are having fevers or pain that last longer than 3 days, that's typically when it is recommended consulting with doctor. What are the benefits of alternating Tylenol and ibuprofen? Alternating Tylenol and ibuprofen is an easy way to keep fever away. Tylenol is dosed every 4 to 6 hours, no more than 5 doses in a 24-hour period, while ibuprofen is dosed every 6 hours, no more than 4 doses in a 24-hour period. As you may have guessed from the description previous, Tylenol is best used for fever, aches and pains but will not be very helpful if the pain is due to inflammation. Ibuprofen is more helpful for these symptoms when inflammation is the cause. Which painkiller is safe for liver? Acetaminophen, Tylenol, when taken in reduced doses, maximum 2 to 3 grams per day, is generally considered to be the safest pain relief option for your liver. Is Tylenol a blood thinner? Tylenol does not have a blood thinning effect. Most NSAIDs, non-steroidal anti-inflammatory drugs such as aspirin, will affect blood clotting, coagulation, an effect commonly called thinning of the blood, but Tylenol does not cause this side effect. Does Tylenol make you sleepy? No. Taking regular Tylenol does not make you sleepy or cause drowsiness. However, Tylenol PM, which contains acetaminophen and diphenhydramine, can cause sleepiness, which explains why so it is used as a nighttime sleep aid. Is Tylenol and ibuprofen a good combination? Acetaminophen and ibuprofen are two commonly used OTC medication used for pain. When one alone does not do the trick, they can be safely used together for added pain relief for most people. It is generally safe to take them together because they work differently in the body and are cleared by different organs. China's intention is to make sure that its consumers get information that is accurate, reviewed by an expert, and error free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only. Thank you for watching the video.